This is part 2 of my instructional video on the administration of an intramuscular injection of calcium gluconate to a spiny lizard for treatment of possible hypocalcemia. And I would like to say that this video is made for the use in education of wildlife rehabilitators primarily, and that is because we don't have enough wildlife rehabbers out there treating reptiles, and that may be because you're a bit intimidated by reptiles because you're simply not familiar with them. Maybe you've been presented with a reptile in the past and you weren't really confident with it, so you passed on treating them, and maybe there wasn't another reptile specialist in the area. So hopefully these videos, these educational videos I'll be doing here in the near future, will serve to help some of our reptile wildlife out there if we can get more rehabbers educated on how they may be similar or dissimilar in their treatments to the other animals you're already rehabbing. And this video is not really meant for the layperson, the hobbyist, although reptile rescuers who are already may have a fundamental grasp of basic veterinary medical procedures can benefit from this video, and so that's who mainly this is intended for. And there are three things, just to start off with the basics. Some rehabbers or rescuers who are already performing some of these injections don't actually perform the calculations themselves. A lot of times they'll rely upon a veterinarian to do that for them, but in a lot of cases it can be very difficult, depending on what part of the country you're in, to actually find a veterinarian who is specialized in reptiles. And one of those reasons is because they are rare as far as companion animals go, and you don't find reptiles very often in the agriculture field. So their education in veterinary college is somewhat light for treatment of reptiles. And so if a veterinarian is going to be specialized and have that specialized knowledge of reptiles, when they get out of veterinary college, they have to take some continuing education, some seminars and whatnot, to actually get specialized in them. And due to the cost-benefit ratio of when they get into practice, how many reptiles in a particular community are they likely to actually see in their practice, they may think it's not practical for them to spend the money on the additional education. And but unfortunately, unlike human medicine and veterinary medicine, you can get out of veterinary college with your degree, and once you get licensed, you can see and treat any animal that someone wants to present to you. It's not like human medicine where you know, to be a cardiac surgeon you actually have to be schooled for that. You just can't come out with an MD and decide you're going to be a cardiac surgeon or a brain surgeon. But in veterinary medicine it's not quite the same. So unfortunately you'll have veterinarians out there who will see these animals and charge a premium office visit for it. It does not mean they are specialized in reptiles and have that knowledge. So keep that in mind. But if you can find a veterinarian who is an avian specialist, that will generally work just as good, because reptiles are more similar to birds than they are any other class of animal. So again, getting back to the three basic things you're going to need to know if you perform these types of procedures is you need an accurate weight of the animal, and for that we have Moxie here is sitting on a gram scale, and you can pick up these scales just about anywhere these days, hardware store or a big box store. For patients this small, they really need to be accurate to within plus or minus 2 grams. That's close enough for purposes of these animals. When I'm dealing with hatchlings, I actually have scales that are more accurate than that. But these scales are used for weighing out food portions if you're on a diet, or for weighing mail for postage, so they're pretty easy to find. But plus or minus 2 grams at least, because you need to be somewhat accurate with figuring the dose. And so the second thing you're going to need to know, and this equation is going to be the concentration of the medication you're giving, and in this case we are administering to him a 23% solution of calcium gluconate, which means it is 230 milligrams per milliliter. And the third thing you're going to need to know is a formulary reference which gives you the proper dosage for that species of animal. And in this case I use the formulary found in the back of Douglas Mader DVM's Reptile Medicine and Surgery Manual. It's a very complete formulary, and these three things together are what you're going to need for the equation that you have to figure the dose, and that is dose times weight, which has been converted to kilograms, divided by the concentration, and that gives you the actual volume of the dose you're going to use. And so Moxie here has been pre-weighed, and he weighs 34 grams. And so the next thing you need to do is get your calculator and put the weight in grams, and then convert to kilograms by dividing by 1,000. Your answer is going to be 0.034. You multiply that by the dose that we're using, and in this case from the formulary reference we're going to use 100 milligrams per kilogram intramuscular, and that is for treatment of hypocalcemic tetany and paresis. And so we input that 100, you get 3.4. Now divide by the concentration, which again is 230 milligrams per milliliter, and your answer is 0.0147 milliliter, or cc. And milliliters and cc's, for those who don't know, is the same thing. And so in this case we're going to round this up slightly to 0.015 cc, which would be, in other words, 1.5 units. A 100 milliliter syringe is normally graduated, and it'll have 100 tick marks. Many of them do. This is a half a milliliter syringe, which means, in other words, it's 50 units. And so we will give him 1.5 units. You have to use caution, however, because again, this is pretty basic knowledge, but you just always want to be mindful when you're looking at your syringes. Some of them are not marked out in 0.01 milliliter or 1 unit increments. Some of them are actually 2 unit increments, so you have to pay attention to that. We've already swabbed Moxie's forelimb here with our chlorhexidine gluconate, and this is a 2% chlorhexidine gluconate solution. That's full strength. It can be diluted. Many people will use betadine, and that works as well as a few other topical antimicrobials. I prefer the chlorhexidine because it has a broader spectrum of activity against various organisms. You just want to make sure you don't use the diacetate formulation. There is a chlorhexidine diacetate, and that's made primarily for sterilizing kennel floors and things like that. If you have parvo disinfecting instruments, the diacetate is not meant for topical use, so keep that in mind. Our syringe is already been pre-drawn with our calcium, and so I'm just going to show you the administration here. And we're going to go in the forelimb, which is essentially in the bicep. And the most important thing that you need to remember about actually giving the stick is that with a reptile, because they are scaly, most of them are, their skin is armored, in other words, you need to penetrate below or in between, and he's thrashing on me a little, but we'll get this. you're going to want to make the stick below or in between the scales. You don't want to push through the scales when you're inserting a needle. That's obviously going to make it harder than it has to be to administer the injection if you are pushing through the scales, and you risk injury to the animal and or yourself, obviously. So if you're meeting a little more resistance than you would think would be acceptable, then back off and make sure you're actually taking the needle in between the scales or under the scales. And if you're doing it properly, then in most reptiles, particularly small ones, the needle is going to penetrate just as easily as it will any mammal. So really, if it's any more difficult than that to get the needle in, you're probably doing it wrong. And that is all for this video, and Moxie can now go back to his terrarium to be with his girl, and I'm sure he is glad of that, because as you can imagine, they don't really like this.